different than cardiac arrest. Cardiac arrest meaning the brain not getting oxygen completely. But in heart attack, still the brain getting oxygen, but there is a problem, big problem in the heart. The heart not pumping very well because there is a blockage in the artery supplying the muscle of the heart.
The person had a heart attack or cardiac arrest. And what's the difference? Sudden cardiac arrest results from an abnormal heart rhythm. This abnormal rhythm causes the heart to quiver, so it can no longer pump blood to the brain, lungs, and other organs. Within seconds, the person becomes unresponsive and is not breathing or is only gasping. Death occurs within minutes if the person does not receive immediate life-saving treatment. A heart attack occurs when blood flow to part of the heart muscle is blocked. This blockage is caused when a clot forms in a blood vessel that carries blood to the heart. If the blocked vessel is not reopened quickly, the muscle, normally nourished by the vessel, begins to die. A person may have discomfort or pain in the chest or an uncomfortable feeling in one or both arms, the neck, the jaw, or the back between the shoulder blades. The person may also feel short of breath, nauseated, sweaty, or extremely tired.
There is some signs for heart attack, meaning he is still alive. So inshallah later we'll talk about heart attack in some details. Good. Continue.
Is recognizing the emergency and phoning 911.
This is the chain of survival. The chain of survival, you must follow this chain for the end of the survival. At the beginning, you have to recognize the case and call for help.
After recognizing the emergency and phoning 911, the second link in the chain of survival is early CPR with an emphasis on compressions. This is followed by quick use of an AED, effective advanced care such as that provided by emergency responders and hospital providers who can give advanced support and post-cardiac arrest care. It's important to get help. Seconds are ticking away. In this course, you'll learn how and when to phone for help.
Okay. Now the question is, when I can start CPR, how I know that the person needs CPR? How do you know? 2 points. The patient not response and not breathing. Not response and not 2 points. Not response, not breathing. What meaning of response? Conscious. He responds. His eyes open. When I talk with him, he can answer. He can speak. There's some sound. He can move. At least blinking eyes. So there's a response. So don't do CPR. He's still alive. This is the first point. The second point is what? Not breathing. How you know he's not breathing? Look to the chest. The chest move, he's breathing. Chest not move, not breathing. Very simple. Okay? Like that you can decide the patient needs CPR. Good. Now what are the steps? Let we see the steps.
When we go about our everyday lives, and something like this happens right in front of us, it may take a few seconds for us to realize that this is actually an emergency. When we do, there are steps to follow in determining whether or not a person needs CPR. Before you start providing CPR, you need to make sure the scene.
No, step one, before anything to do, anything, safety first. Check for safety. It's very important one. Okay? I'll give you some examples. You have patient collapsed because he has electrical shock. Electrical shock. And he's still holding the wire. You're collapsing. If you touch the patient, what happened to you?
You'll be the same.
You sleep with him. Becoming too risky, correct?
Yeah.
Yes. So like that, before you start anything, check the scene. Maybe there is a poisoning gas. You will be the second. Okay? In the street, there is car accident. Some car hit a person. if you are running to him, maybe another car coming and hitting you. There's a collapsed building. There's something falling from up. Okay? Falling to the patient, it's becoming collapsed. Maybe another stool or something falling on you. So you have to clear the area. There's a person drowning in the sea. And you didn't know swimming. You cannot jump. If you will jump, you will drown also. So like that, before you start anything, put in your mind, safety first. Don't be the second victim. This is the important one. After that, check response and the breathing. Okay? To be sure. You need CPR or not?
Is safe. Look for anything nearby that might hurt you. You can't help if you get hurt too. Next, you need to check to see if the person is responsive. Kneel at his side, tap him and shout, "Are you okay? Are you okay?" Someone who is responsive moves, speaks, blinks, or otherwise reacts when you tap him and ask if he's okay. Someone who does not move, speak, blink, or otherwise react is unresponsive. If the person is unresponsive, shout for help. Here's a demonstration. While leaning over the person who is down, check to see if the person is responsive. Tap his shoulders and ask, "Are you okay? Are you okay?" If the person does not move, speak, blink, or otherwise react, then he is unresponsive. Shout for help.
So check response by tapping the shoulder like that. Hey, hey, and shout. Hey, hey, are you okay? Are you okay? And see. Response or not response? Okay? If not response, it's big important. So this is emergency. You need to answer. His eyes closed. Not moving. There's no sound. You have to shout for help before to check that second point of breathing. Ask for help. Shout, "Help! Help! Somebody help me!" If somebody comes, send him to call for help.
Help! Help! I need help. If someone is nearby and can help, have that person phone 911 and get an AED. Say, "You, phone 911 and get an AED." If no one comes, then phone 911 yourself. In an emergency, the sooner you realize that there's a problem and get help, the better it is for the ill or injured person. When Gene didn't get a response from Anthony, Gene asked Maria to phone 911, and Mark offered to get an AED. Gene then performed the next step.
After that, you can check for breathing. How you check the breathing? Look to the chest. The chest. Move or not move? If the chest move, breathe. Not move, not to breathe. Okay? Take your time. Correct time for that, 5 to 10 seconds. Not less than 5. Not more than 10 seconds. Up to 10 seconds.
And assessing the need for CPR, he checked for breathing. It all happens quickly, but this is important. When the person is unresponsive, scan the chest for 5 seconds, but no more than 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, he needs CPR.
So when he needs CPR, not respond, not breathing. Together. One of them not enough. And you can find a patient not responding, but still breathing. Don't start CPR. Still breathing. Okay, it's not response, he has a problem. But if still breathing, don't start CPR. Again, you have a patient still standing, suffocated with foreign body, and still response standing, but he's not breathing. Also, don't start CPR. He's not breathing, but he's still conscious, still response. So do CPR only if two together. Not
No
response
And no breathing.
or not breathing. Read that point?
Yes.
Then move the clothes out of the way to bare the chest. If a person is gasping, it usually looks like he is drawing air in very quickly. He may open his mouth and move his jaw, head, or neck. Agonal gasps are frequently present in the first minutes after sudden cardiac arrest. These gasps may appear forceful or weak, and some time may pass between gasps because they usually happen at a slow rate. The gasp may sound like a snort, snore, or groan. Gasping is not regular or normal breathing. It's a sign of cardiac arrest arrest in someone who is unresponsive.
And sometimes you find the patient, you reach with him in the gasping stage. Gasping meaning this is the last breath in his life. Once you see gasping, don't think this is real air breath. No. You have to start CPR if he is not responsive.
It's important to recognize cardiac arrest as quickly as possible. CPR keeps a person's blood and phone to bare the chest and begin chest for destruction. 911, are you okay, sir? It's important to recognize cardiac arrest as quickly as possible. CPR keeps a person's blood flowing until other medical care can be given. Let's look at these steps all together in assessing the need for CPR.
Now the steps, step by step. Step 1.